how common is it amongst men? Can you tell us a little bit about that?
Erectile dysfunction is incredibly common amongst men. It's estimated that about 40% of men over 40 and 50% of men over 60 and 60% of men over 60 suffer from some form of erectile dysfunction. So it's a really common problem. And why it's so important is that it's often associated with important underlying medical conditions. And it's the first sign, so that we need to ask patients about the problem, because it can come on years before the actual medical conditions such as blood pressure, diabetes, raised cholesterol, heart attack, enlarged prostate, lots of important medical conditions.
And what's the difference between maybe the odd occasional performance issue and actual diagnosed erectile dysfunction?
Well, the definition of erectile dysfunction is the ability to attain or maintain an erection sufficient for satisfactory sexual activity. It doesn't mention whether that's all the time or once in a month, but generally speaking, it has to be a consistent problem. So any man can have a problem one-off if he's had a few drinks, or he's excessively tired or worn out from a hard day's work. Of course. So we're talking about a persistent problem on many occasions. And the most important question to ask is about morning erections, because morning erections are when the body goes on to autopilot. So if men lose these morning erections when they wake, then that's much more suggestive that they have a medical condition causing their problem.
I see. And is this a sign that you would look for as a precursor to something more dangerous, or a sign that there's a disease in progress?
Yes, because basically what the body is telling us is that it's unable to get the right amount of blood through a rather small artery down to the penis. And small arteries will tend to get blocked well before bigger arteries. So if you begin to get problems with getting blood flow down below, it means that in 3 to 5 years, if the same conditions continue untreated, you'll be getting problems with bigger vessels later on. For example, the heart or even the brain. So it's important that we don't just put it down to stress or something else, that we always take it seriously when the problem arises.
That's really good to know. I think we've touched a little bit about morning erections in previous podcasts, but it's good to hear it from your perspective of this being a really a big early sign into seeing that something is potentially wrong with the person.